Hello everyone, myself Dr. Suresh, Professor of Biochemistry, and in this video I'll be telling you the clinical significance of urea, which conditions urea levels will be increased, what are the normal levels, and what are the clinical manifestations of higher levels of urea in our body. Okay, so the normal range of blood urea in our body is 20 to 40 milligrams per deciliter. So range above the normal is known as hyper condition, hyperuremia. Okay, and the range below the normal range you can say hypouremia, right? So here, what are all the reasons behind the abnormalities in the normal level? Okay, so urea, not only the excretory product of protein metabolism, so the production of urea or the amount of urea produced is also indicator of, because it is excreting from the body, so it is indicator of renal function, it is also indicator of liver function. Okay, so in which conditions the range may increase, though there is a normal level of urea production, but if the urea levels are high in our body indicates renal failure. And in case of age, with the increase of the age, the urea production also increases because of more protein degradation. And but in case of protein intake, there is no increase in level of urea. So if there is a abnormal levels, I mean like high range of urea, which can lead to hyperammonemia and you can say hepatic coma. So here in case of acquired hyperammonemia, intestinal bacteria and ammonia detoxification in liver, portal systematic encephalopathy, altered sensorium, convulsions, ascites, jaundice, hemorrhage. So all these are the clinical features of hepatic coma. The signs and symptoms are mainly pertaining to CNS dysfunction, altered sensorium and convulsions are manifestations of failure of liver function, ascites, jaundice, hepatomegaly, edema, hemorrhage, spider, navy. The management of this hyperammonemia and higher levels of urea, it is difficult. So the main lines of treatment are low protein diet, you are supposed to get it, and bowel disinfections using antibiotics and clearance by lactulose. Avoid hepatotoxic drugs because ammonia is dealt by liver, and if there is some problem with the liver, there is no excess production of urea and simply there is accumulation of ammonia. So maintenance of electrolytes and acid balance is also one of the key features in maintaining the normal urea levels. So urinary excretion of urea is 15 to 30 grams per day. That means 6 to 15 grams of nitrogen will be expelled out of our body. This corresponds breakdown of 40 to 80 grams of proteins per day, roughly 100%. Okay, and urea constitute 80% of urinary organic solids. So measurement of ammonia levels is very critical parameter for assessment of variety of genetic and acquired conditions. The most important genetic cause of hyperammonemia are urea cycle disorders and organic acidureas. Organic acidureas usually present with life-threatening metabolic acidosis and hyperammonemia, whereas urea cycle disorders often have metabolic alkalosis along with hyperammonemia. Ammonia levels may be elevated in hepatic coma, okay, like hepatic encephalopathy. In this condition, liver function test will also often be grossly abnormal because ammonia, as I told you, metabolized properly by liver. Other conditions where ammonia is elevated include cor pulmonale, pulmonary emphysema and renal failure. In this condition also ammonia will be elevated. So the schematic flow chart which showing differential diagnosis of hyperammonemia, because ammonia is toxic compared to the urea. Okay, so it's a life-threatening condition, hyperammonemia. So how to diagnose? Okay, so differential diagnosis of hyperammonemia. So in case like ammonia increase, suppose ammonia, pH, electrolytes, ketones in the urine, so there might be the reasons there will be increase in the ammonia and then you cannot see the acidosis. At the same time, there will be ammonia normal, no acidosis, dinitrophenyl hydrogens, and they are you can get positive in urine. At the same time, NH3, ammonia normal in level but causing acidosis, anion gap, ketonuria you can see. And next, ammonia normal, no acidosis, DNA pH is also negative, so further analysis has to be done. So if there is first one, ammonia levels are high and no acidosis, so you should think there is defect in urea cycle and triplet syndrome. And if it is ammonia is normal, no acidosis, and but you are getting DNA pH positive, so amino acid analysis you have to do, and you can say it is maple syrup urine disease. It might be because ketones you are getting, so obviously it might be maple syrup urine disease. And if in case NS3 is normal, acidosis is there, and anion gap you can make out, and ketonuria, so organic, like OA analysis, that means like organic acidureas like phenylalanine, like isoleucine valine, GA and MMA. So all these things you can make out in the urine. Okay. So again, NH3 normal, no acidosis, and DNP is also negative. Again, amino acid analysis you have to see, and non-ketogenic amino acids also, and metabolically maintained amino acids also you can have to check. So this way you have to make out different types of hyperammonemias and by making of diagnosis. So that's all about ammonia toxicity, and then urea clinical significance and its role and their normal levels. Thanks for watching. Thank you.